Okay, I believe I'm live, but I cannot see myself. So if you are joining in, please let me know that you are here. Again, I think I'm live, but Facebook says I'm live, but I don't see anything when it comes to me. So if you are joining me tonight, if you could click uh, live and hey Dave, okay, so you're seeing me. That's great. If you are catching the replay, if you could comment replay for me down in the comments, that would be great. So happy Wednesday is hump day. We have gotten over the midway of the week, and so I'm super excited about that and hope everyone has had a great week. For those of you who are new to the group, I'm Monica Tillett. I'm a doctor of physical therapy, and I own a mobile physical therapy clinic called New Direction Rehabilitation and Wellness. And I started this group because I love balance and everything related to balance. And I know that balance is the primary thing keeping my patients from being safe at home, from being as independent as they want to be. And it also, can be their lifeline between am I staying at home or do I need to move into a retirement community? So, tonight I wanted to talk about medications and fall risk. So, if you are, taking a whole bunch of medications, and I kind of spoke about this a little earlier in the week in another group, but I want to go into a different aspect tonight with you guys. Is that if you're taking a lot of medications, you just want to be careful, because one, depending on the medication that you're taking, one medication could cause a side effect of dizziness, but if you are taking multiple medications, prescription medications at one time, then just the combination of those interacting together can cause dizziness. And dizziness can often result in falls if you are trying to get up and walk and do things in standing. Okay, so just a little fact finding for you. Um, People taking 5 to 9 medications, prescription medications, will experience about a 50% chance that they are going to have drug interactions between those medications. Okay, so 5 to 9 medicines has a 50% chance of interacting with each other negatively. Okay, people who are taking 20 or more medicines, and I know that sounds like a lot, but for those of you who don't know, that average senior over 65 who may even be residing in a like a skilled nursing facility or something like that, they're on an average about 15 medications. So depending on how chronic their conditions are, how complex they are, if there are some people on 20 more medications, they're saying there's about a 100% chance that these drugs or medications are going to interact negatively with each other. So, hey, Miss Delphine, thanks for joining. Mom, thanks for joining along with Dave. Thank you all so much. So, I want you guys to comment below. And Dave, I know you're another physical therapy practitioner out in Charlotte. But for anyone else who is 65 or over or nearing 65, if you want to comment below, how many medications are you taking? I know many of you may not be taking 5 to 9 medications, but just curious, well, how many medicines, are you taking each day? Okay. All right. So, my next question I want you to answer in the comment box, and this can relate to any amount of medicines that you're taking, and that is, does your primary physician know all of the medicines that you're taking. And so the first one, if you want to share it, share how many medicines you're taking. And then the second one is for everyone, because I think that's important no matter how old you are, is does your doctor know how many medicines you're taking? Okay? Because it's important. A lot of times, our older adults get on so many medications because they see a lot of specialists. And the specialists often prescribe medicines, but these things don't get back to the primary doctor. And I wish there was this big health portal that no matter what clinic you're working in, no matter who you are documenting, that everyone could see um, what the other one is doing, and I don't know if that is going to would go against HIPAA regulations or anything like that, but at least the main things like your diagnoses and the medicines that you're taking should be something that's available for any person that is prescribing medication so that they can see what you're already on. Okay, Miss Delphine, 4 to 5. That's on the low end, so that's really, really good. Um, and does your doctor know every medicine that you're taking? Think about that. And if they don't, make it a point. Perfect. Yes, they do. That is awesome. Mine does too. I'm 38 years old, but my doctor stays, well informed of everything that's going on with me. So, because I just think that's so important. But okay, so keep moving on. We are going to talk about um, how the effect of the number of medications can take with your ability to perform your daily activities. So, more facts that I found on the internet was if you're taking more than 5 medications, it has showed um, that people have a decline in the ability to perform their ADLs. And what ADLs is activities of daily living, things that you have to do every day to, like bathing, dressing, cooking, cleaning, those types of things are things that some people do every day. Bathing and dressing should be something done every day. But if you're taking five or more medications, that could interfere with your ability to do those things. And those who are taking 10 or more medications, it has been shown that their overall functional capacity, which is their endurance, their ability to tolerate doing different activities during the day, it can affect their ability to do that. So, if a way to treat this is, like I said, talk to your doctor, make sure they're reviewing everything that you're on, so you're not taking maybe 2 medications for the same thing unless it's on purpose. Sometimes some people take 2 blood pressure medications or 2 diabetic medications, things of that nature. So just make sure there's not double pharmacy there with the medications. Um, so let's talk about what medicines have actually been proven to contribute to falls. So there's a few of them. The first are some blood pressure medications. So they're called antihypertensive agents, diuretics, and beta blockers. So if you're on any of those 3 classifications, they help treat blood pressure, then you could experience a fall from these medications because one, the side effects could be causing dizziness, or two, like with the diuretic, you could just have a frequency of urination. So trying to get to the bathroom in time, you're rushing, so you don't have an accident before you get there. Those types of things can cause falls. The next set is sedatives and hypnotics. So those medications that are treating anxiety and sleep disorders have been linked to falls. Also, neuroleptics and antipsychotic drugs. So those are drugs that treat delusions, hallucinations, and other psychiatric disorders. Um, Antidepressants. So those that are treating depression have been linked to falls. Diaphapines. Excuse me, that's a complicated word. But those benzodiazepines, they also treat anxiety, panic attacks, and seizures. And then the last two are narcotics and non-steroidal anti-inflammatory drugs, otherwise known as NSAIDs. So, those medications that could be used to treat inflammation, those types of things, and pain. So, if you are taking any of these medications, I'm not saying stop taking these medications. I'm not saying tell your doctor to take you off of these medications. What I am asking you to do is take an assessment on how these medications are affecting you. If they are affecting you, they may not be. Again, everyone's medical condition is different. Everyone's biological makeup is different. So, how the medicine breaks down inside of the body is going to be different between every person, which is why some people experience some side effects and others don't. So, if you have medications that are causing a lot of dizziness, then take account to when the dizziness is coming. Is the dizziness seem to be kind of constant throughout the day because that system you're having, that medicine is in your system all day long? You're having to take it maybe multiple times a day. And if you are having dizziness that is lasting, those more constant periods and long term periods, you may want to look into using some type of assistive device. So, a rolling walker or a cane, something to help give you a little extra stability while you are up standing and moving around, because dizziness and standing up and moving around are not great combinations, so that is going to put you at risk for falls. But if your dizziness is coming on because maybe you just stood up, and when you stand up sometimes the medications cause you to be lightheaded upon standing, then you just want to wait until that dizziness goes away before you start proceeding into walking. So take account of those things, assess what's going on with your body, and if it's something that is really, really bothersome and you notice that it's really affecting your function and safety, then talk to your doctor about your medications. But then you can also talk to a physical therapist in your area, so that they can assess you and make sure that it's not something else going on like vertigo, and or we can assess your blood pressure in different positions and making sure that your blood pressure isn't too low, when you're changing positions. So it's just about being mindful. So if all of that makes sense, comment below makes sense, or if you have questions about anything in particular, comment the questions, and I'm gonna, just keep a look there on the comment section. But again, thank you everyone for joining. And just remember, I may sound like a broken record, but keep your physician informed of your medical conditions, and also don't be ashamed if at some point in time you might have to use a cane or walker to keep you upright until you can get to a physical therapist to help you restore and regain that prior level of function that you were used to experiencing. So I don't see any questions or anything in the comment area. It may be a little slow at Facebook tonight. Again, I never know when I click live what in the world is going to happen. I can't see you, but hope you guys can see me. And thank you everyone for joining, and I hope you have a great night.